Today we have Janice Kaffer joining us, President and CEO at Hôtel-Dieu Grace Healthcare. Janice, welcome to the show.
Well, thank you very much for having me. I'm glad to be here.
Well, this is always the very first question. How are you doing, and how's your family doing?
Well, I think, like probably many people, I'm tired. We've been working really hard here to get ready for all the things that we have to do. Family-wise, I have 3 grandchildren that I am FaceTiming on a regular basis. My husband, I've sent him upstairs to live in the upstairs level of our house, and so we're staying apart because I work here and he has some medical issues. We're social isolating, distancing in our home. But the interesting thing about the grandkids is my daughter told me yesterday that they were having a discussion about who's the best cook, and I've been baking on the weekends. And I'm a terrible cook, but I'm not a bad baker. And all of a sudden, I've jumped to the top of the list. I think it's because the kids are missing me so much.
Yeah, that's a very difficult time, and thank God for FaceTime.
It's a wonderful thing. It's an absolutely wonderful thing.
Yeah. So, Janice, tell me, what's your role in the healthcare system, Hôtel-Dieu Grace Healthcare?
Yeah, it's interesting. I think a lot of people don't know what we do. We're what we call a post-acute hospital, which means that typically in a normal world, and we're not in a normal world at the moment, but in a normal world, what we do is we take patients that have had an experience at the acute care center, but they're not quite ready to go home yet. So we do a lot of rehabilitation. We have folks here who live on mechanical ventilators. We have folks here who need longer-term hospital stays because they have wounds and things like that. Plus, we have the long-term mental health patient population here, and well over 120,000 outpatient visits a year for lots of different things like cardiac wellness and rehabilitation. So in a normal time, that's what we do. What we're doing right now, what we've been doing over the past 2.5 weeks, is we've been taking all of the patients from Windsor Regional Hospital and Erie Shores Hospital that don't need to be in an acute care hospital. So those are folks that are usually called alternate level of care patients. So we have all of the folks that are waiting to go into a long-term care facility here now. So they've all been transferred over here to us so that they're out of the acute care hospital. We continue to take all of the patients that need that rehabilitation and complex medical. And we've opened up 40 additional beds and another 30 to come on April 15th. And some of the people that will go in those beds will be individuals who maybe have had a medical issue and really should still be in acute care, but they're getting closer to going home. They can come to us with some supports while acute care is dealing with the crisis or the surge that they may or may not have with the COVID patients.
How's this affecting the capacity?
Well, we are sitting very high. Our capacity, we're pretty close to 85, 90% on any given day of our capacity. Our acute care partners are all sitting somewhere between 50 and 60%. So they are well positioned to be able to respond to acute care needs associated with the virus. We have capacity here still, and we are opening more. Part of our job then is to make sure that as acute care gets filled up with patients who are ill, that we are taking every single person that could potentially come over here to keep flow going through the acute care hospital. But our capacity is pretty high. Our staff have been very, very busy. Our normal March numbers, we exceeded them by more than 40% year over year, admissions and discharges. So our teams have been working really, really hard here.
Yeah, and I think, I should just say, you have to thank yourself and your staff for all the hard work that all the healthcare workers are going through and making sure that everyone is safe and healthy and being taken care of. So make sure you pass that on, because I think
I will do that. Thank you.
And my wife is a nurse, so I thank her every day.
One should thank all their healthcare workers every single day, not just during a pandemic, I'll say, but our staff really, they're grateful for the outreach of the community, and they're grateful for some of the businesses that have been dropping off pizza and treats and things, and so they're very grateful for all of that recognition. And so thank you to everybody who's sent a note or said thank you.
Excellent. How has COVID-19 affected Hôtel-Dieu Grace Healthcare, and what measures have you taken, especially partly with visitors?
Yeah, so we started screening early. We've taken some measures a little bit ahead of some others simply because of the population we have here. We have a very vulnerable population. So like I said, we have all of the folks in hospital now that are waiting to go to a long-term care facility. So that's the senior population. We have over 30 or so individuals, and we have folks who are living on a ventilator. So those are very respiratory challenged individuals, as well as folks who have trachs and some other challenges. So we started screening and limiting visitors very early in the process. We are now at a place where we aren't allowing any visitors. And one of the most difficult things for us is that we are a very patient and family-centered organization. So we had a real hard time figuring out how could we partner with families. So we've created something called a family resource team, and that's from some of our staff members that have been redeployed because their outpatient programs are closed up right now. And so their job is to help some of our patients connect by FaceTime and through technology, to make phone calls, to sit with some of our patients who are used to having daily visitors. As the weather gets nicer, hopefully to be able to take them down to some secured, fenced-in courtyards that we've organized so that some of our longer-term patients can get outside when the weather gets nicer. And so that family support team is going to be critical to helping our patients weather this, because we're talking about potentially months that we are going to be unable to have family members coming into the building. And that's difficult for our staff, it's difficult for our patients, and extremely difficult for the family members.
Yeah, it's a very difficult situation. I know one thing that recently changed. Tell us about the Regional Children's Center Counseling Clinic.
Yeah, one of the things that's we've been talking a lot about here is the level of anxiety, concern, worry, fear in the community, and the impact of closing up all the mental health programs. Right, that's a significant challenge. So what we've done is we've kept most of our mental health programs up and running as much as we possibly can through telephone. And one of the last ones to move to telephone and virtual visits is our Regional Children's Center Walk-In Crisis Center. And that's moved today to a telephone service. And that's, again, to protect our staff and to protect the patients and families that are coming in, the clients and families. Folks will still get service, but they'll get it in non-traditional ways. And a lot of our social workers and staff from the Regional Children's Center have been doing a lot of that telephone checking in with our families and with some of the kids that we look after. And our TSC downtown is still open as well, and we're taking a look at how do we make sure that we're providing good service. There's another piece of work that we're working on with CMHA that'll hopefully be announced next week that will also provide some mental health supports.
Great. Lastly, stress is at a all-time high level for yourself, for your staff, for the patients. What systems have you put in place to try and alleviate some of that?
You know, I was a frontline manager during the SARS crisis, and I remember how it felt to be on the front line. I'm a registered nurse, and I've been a nurse now for 35 years, and so I've been through quite a few things. Nothing like this. This is probably the biggest thing I've ever been through. But one of the things I learned during SARS is the importance of communication in helping to manage anxiety and stress. And so here we've actually developed a comprehensive communication strategy. So I round on all of the units every day. So Mondays I'm in CMC, Tuesdays I'm doing some virtual check-ins, Wednesday I'm in rehab, Thursday I'm in TNI, and Friday I see all our support teams and some virtual visits with our outpatients. That's starting tomorrow. We have a daily update. The executive team is rounding on off shifts, and we're taking all of that information from staff, and we're doing a daily email update with questions and answers. We've started last week little video updates. They're kind of raw and informal, but it's just another way of touching base with our staff. And what we've heard from our people here at Hôtel-Dieu is that makes a big difference because they feel as though they have the information they need. And it's been important because information has changed a lot. what we know now is very different than what we knew 2 weeks ago. And if you depend on people reading memos from 2 weeks ago and that information being current, it isn't. And so that's some of the stuff that we've been doing. There's also really good supports. We have a peer support team that has been mobilized, and that's staff members helping staff members talk about issues. And like I said, we have a family support team that takes a little bit of the burden off, looking after some of the patients that we have that have family caregivers that aren't in the hospital at the moment. And then we also have another team of redeployed staff that are extra hands on the units. And so we think with all of that, we've covered most of our bases. But I think the biggest thing, quite frankly, is the amount of coverage of COVID. Like, you turn on the news or you open up your social media and there's nothing else. And I think it can get overwhelming. And so there are also some provincial resources and some local resources from CMHA that are really important. Tips on staying connected and looking after your mental wellness right now is really important.
Yeah. Well, Janice, I thank you for your time. I really appreciate it. Please pass on our best wishes for everyone at Hôtel-Dieu Health, Grace Care, and yourself and your family. Please stay well and stay safe.
Thank you so much. Same to you.